So I'd really like to start the video this week by doing a bit of a check-in with you all. I'm really curious how you're all doing. The isolation's going on for quite a while now. I think we're heading into about 7 weeks in Australia. And this is the weekend that we're going to find out if anything's going to be lifted, if we're going to be allowed to see some of our loved ones, who might be allowed to go back to work and who's not. So I'd love to hear how you're all doing and where everything's at in your various countries. Now for today, I thought I'd take you through a little bit of anatomy of the spine and pelvis. So it's something that can be a little bit time consuming in class, and it's a really nice thing to get to know your own body, especially as you're moving your body a little bit more, to know where everything is. I'm going to turn him around. I'm going to start with showing you that at the top, this is the base of the skull. So often when we do our chest lift, I talk about hooking your thumbs into the base of the skull. And that's where the thumbs actually sit when I talk you through that. Now the cervical spine, or what you know more commonly as the neck, is 7 vertebrae that run this way. Now he's a little bit old, so it's not quite as curved as a lot of people's necks, but it actually curves towards the front of the body. So this is the front of the body, this is the back, and in the neck there's a curve that goes this way. In the other direction, starting from here, is your thoracic spine, and that's 12 vertebrae, and they actually have a curve the other way, and that's called a convex curve. Now the lumbar spine is the bottom 5 vertebrae, that's what we know as the lower back, and they curve again towards the front. So in class, when I talk about finding your neutral pelvis, neutral spine, and allowing a little bit of space underneath your low back, it's because that's the natural position of the lumbar vertebrae. Coming further down, we have the sacrum, and that's 5 vertebrae that were originally separate, but they fuse as you grow up. So I often call that the triangular bone between your pelvis bones. Now at the very tip of that is the coccyx. It's quite a little bone, as you may be able to see. And that's also known as the tailbone. So I actually had somebody ask, how do I find my tailbone? So if you're trying to find it yourself, you walk your fingers down the back of your pelvis until you hit the point where the bone ends and all soft tissue begins. Now turning him around, you have the main pelvis. So the pelvis is made up of what's called the ischium, the pubis, and the ilium. But they're all fused together. So the ilium has the iliac crest. I'm not going to take you through every landmark, but there's a couple of important ones. The iliac crest runs across the top. So when we put our hands on our waist and press down, that's where we find that top bone. From there, we walk our fingers down around and we have the anterior superior iliac spine, otherwise known as the ASIS. So that's those front pelvis bones towards the center of the body that I talk about quite a bit as well. From here, now most of this bone disappears and you can't really feel it, but the thing you can feel is your pubic bone. And you'll notice that there's 2 with a little bit of cartilage in between. So that's when we run our hands down and press our fingers down and find that bony bit, and that's the 2 pubic bones next to each other. Turning him around, you have your ischium. And your ischial tuberosity is the next part of bone that it's quite easy to feel on your own body. So that is called the ischial tuberosity, or your sitting bone. So that's the bone we want to sit on when we're looking for a nice seated posture. We can sort of rock back and forth, find the tip, stack our spine above, and that brings you into a seated neutral spine most of the time. The last one I'm going to talk about is your hip joint. So the hip joint is made up of your femur and the acetabulum. So it's a ball and socket joint. And the part of your hip bone that you can actually feel is out to the side there. The ball and socket joint is actually more around the front. So that's just in here. You can see it rotates back and forth, flexes and extends. Again, he doesn't have that much movement because he's a bit older and because he's attached with screws rather than with ligaments and tendons and that sort of thing. And then you have your femur, which is your thigh bone that runs down. So I hope that you all find this helpful to get to know your bodies a little bit better and hopefully to make a little bit more sense of which bones I'm talking about when I'm teaching you in class. Thanks very much for watching. I hope you all have a great weekend.